Hi Sanjay, my name is Zoe Hunter. I'm a nurse here. How are you feeling today?
Okay.
You're okay? Do you mind, I just need to check your wristband, do you mind just showing me? Could you tell me your full name?
Sanjay Patel.
Okay, what's your date of birth?
July 6, 2000.
Okay. Do you know where you are right now?
Yeah, I'm in a hospital.
Okay. Do you know why you're here today at all?
Honestly, no, but my parents sent me here, so I guess I'm here.
Was there an incident with your parents or anything like that?
No. No, I think they just think I'm crazy. I tell them I see cops everywhere.
Yeah.
But they don't believe me.
I can see that you're feeling maybe a little anxious. Is there anyone here right now that you think might be?
They're outside, I think.
They're outside, but there's no one here right now. Is there?
I don't know.
You don't know?
There could be.
Okay. Could you tell me more about the cops that you think are out to get you?
They're just cops. Angry asshole cops.
Can you tell me more about the cops that you think are out to get you?
Yeah, they're always just out to get me. They follow me to work, from home to work. They're always around. They can't let me do my job. I just want them to leave me alone. Like, I didn't do anything. They have to just leave me alone.
Okay. Where do you work?
I work at Starbucks.
And do you like working there?
Yeah, I like it a lot.
And what do you like about working at Starbucks?
I don't know. I like interacting with customers. I like making coffee.
That's nice that you enjoy working there. Are you hearing or seeing anything out of the ordinary?
Maybe I am. I don't know. Maybe my parents are right. Yeah, maybe I should be in the hospital because maybe I am seeing these cops.
Like maybe the cops aren't really there? Is that what you're trying to say?
Yeah.
Okay.
Yeah.
Okay, so Sanjay, it's really important that you report any side effects you might have, like how you said you're feeling sort of tired and not like yourself when you're taking your medication.
Yeah.
Because when you stop taking your medication all of a sudden, you might have some symptoms or some things that might happen called withdrawal symptoms that can be kind of dangerous sometimes. So what we like to do is we like to slowly lower the dose instead of stopping all of a sudden. So it's important that when you're not feeling like the medication's working for you, you contact your doctor so that he can work that out for you, okay? Okay, Sanjay, I'm going to go talk to the doctor and I'm going to see if he can come have a visit with you, and we'll see if there's a medication that works better for you. Is that okay?
Yeah, that's okay.
And do you have any questions for me at this time?
No. But thank you for everything, all your information.
Okay, I'll be right back.
Aspects and see how they kind of like work in a family, how the family.
When we were playing out the scenario, I just found that the scenario was really different from what I actually experienced at KMH. Like, for example, like the questions that the nurse would ask. I find that the nurses at KMH, they ask questions like very casually. It's not very formal. They just really go up to the patient and they would just ask, oh, how are you feeling? Do you hear voices?
Like the suicide assessment or the hallucination assessment.
Right. They're very like straightforward.
Yeah.
To the patients, but it might be like Halima was saying.
So I was just saying how like in this scenario it's more of an acute. So the patient's just coming in and
they don't know the patient. Like
exactly.
on 2-3, like the nurses know all the patients. they have rapport with the patients already, so it's
Yeah.
different than if it's someone you don't know and you're trying to figure out how are you going to interact with them.
Right, yeah, because our placement is in a more of a chronic
setting, yes.
patient setting, while the scenario that we did was an acute setting. So maybe that's why I felt like the questions were very different.
So what did you think as a patient?
So from a patient's perspective, I feel like there's a lot of patients we meet on 2-3 that some are very quiet and reserved, and it's hard to get to know them and get some rapport with them. And then there's others who are just like really willing to tell you everything. But from like patient's perspective, I feel like I was giving Zoe like kind of in between. Some things where she needed to work harder to get at, some things I was just willing to say. But she did a good job, and made me realize how important therapeutic communication is. But she made me feel safe as a patient. She made me feel like what I was saying was being heard and not being judged. And like from a patient's perspective, it's really important to feel comfortable and safe, so that you can really truly express yourself. So I think in the future I just need to take more time, be more vigilant on what I'm saying, and think more about therapeutic communication.
I think that was also very important because when we were coming up with these questions for the case scenario, it became a little bit difficult because we wanted to know exactly how we should ask the question without having to either blame the patient for any reasons for why they're not taking the medication or for having a hallucination. We started kind of getting confused about how do we go about this when
it's true,
trying to avoid,
That's true. This the scenario really put I think we can empathize more with patients now because we're trying to put ourselves in their perspective. I don't know, that's what I felt.
Yeah, because we had to come up with a backstory for Sanjay.
Yeah.
Because there wasn't really a lot of information in the case scenario, so being able to put ourselves in Sanjay's place. Yeah. But it was hard to figure out how to word things because, like everyone else said, the way we ask questions at CAMH are very quick, and this way it's trying to find a way to word it without making it sound sort of weird or I don't know.
It's super informal kind of we're not informal but very not as casual.
And it's very different in real life the way you don't know how clients are going to respond to how you're asking a question versus the case scenario where we can kind of expect what Brandon's going to say or how he's going to respond because we've already discussed it in advance. So it could have probably been more realistic if we had just kind of jumped into it, but it's hard to do when there's not enough information. So anything else?
I was going to talk about I'm just
let it run.
what was I going to say about
what else do we have to talk about?
What was done well.
Okay, so here I have something else. So you can cut out that little bit.
I was going to.
Another thing I think we did really well was talking about how important the medication is and ensuring that the client doesn't just stop taking it all of a sudden because there's things like neuroleptic malignant syndrome and other withdrawal symptoms that can actually be really harmful to the patient. So just trying to reinforce that, we understand it might not be working for you, but you need to talk to a health professional before you stop taking it because it can be really dangerous for you to do that.
Patient education.
But also at the same time, I was thinking, what would you say to a patient who doesn't know, why they have to take medications?
They don't have insight.
Yeah, exactly. When they don't have insight or when they think they're perfectly normal, that there's nothing wrong with them.
Yeah.
I think also because it was a more of a one-to-one interaction between the client and the patient, I think in the real world we would actually involve the parents to hear what they have to say because they're also a key informant. And then because they were South Asian, there's obviously we got to consider the cultural aspects and see how they kind of work in a family, how the family dynamic works. So,
But it was nice that when Sanjay said that he felt like cops were out there, instead of the nurse just kind of like telling Sanjay that, oh, that's wrong, that's not right, that's not the reality, she actually told him that it was a safe place here, that the patient could trust the nurse. So that was good, like therapeutic relationship, like good approach to building a therapeutic relationship.
I guess this just really highlighted the nurse's role. It's all about communicating with the patient, making them feel safe and comfortable, knowing that they have someone there that they can talk to and trust. It's also education was key, as Zoe was saying about the medications. But then it's also, I think, we are like the bridge between all other healthcare professionals in the healthcare team, right? So.
Mm-hmm.
Some angry asshole cops.
Okay.
Yeah, don't move though.
Say that.
I don't know. What was I supposed to say about cops? Maybe my parents are right. Maybe I am seeing these cops. Kelly?
You hear any voices? Fuck off.
Why? What's wrong?
Stop.